It's time for NuWellness TV with Dr. Lee. Join your host, the accomplished Dr. Cherilynlee, as she welcomes the leading experts in health and well-being as they explore the advancements in natural health, physical fitness, nutrition, integrative medicine, and self-discovery.
Okay, Shievon,
Yeah.
we're on. Thank you.
Hi, and you are watching New Wellness TV with Dr. Lee. Dr. Lee is a holistic practitioner. She's a physician assistant. She's also a registered nurse, and she's been practicing holistic medicine for over 30 years. We are joined by Dr. Blanche. Oh, I'm so sorry.
Grube.
Grube. I
Grube.
see. Dr. Blanche Grube. Dr. Blanche Grube received her doctorate from the University of Medicine and Dentistry of New Jersey. She holds a second doctorate in integrative medicine from Capital University of Integrated Medicine in Washington, D.C. She's been practicing for over 3 decades. She is a pioneer in the field of holistic or biological dentistry. Thank you for joining us.
Thank you for inviting me. This is wonderful. I'm speaking to you from beautiful sunny home on my vacation, my winter vacation.
Nice. Chasing the
Yes.
sun, huh?
Yes, I
Yep,
wish we were
very.
there with you.
I wish you were also.
Yes, and we have so many mutual friends, and Anita is my sister from another mother. So
That's the same here.
I'm so happy that she connected us, and this is going to be a wonderful power-packed show. And I just want to say on the biological dentistry, what drove me, and I'm not a dentist, to become more active in this field is number one, in my own health. And then secondly, the first component was a dear friend of mine about 25 years ago who had a patient who had liver cancer, unfortunately. And he kept going in and out of remission. And finally, his doctor was able to say, look, go back to your dentist, have them remove the cap, do a cavitation. And he did. And long story short, he was able to do quite well. My own history and journey, it was very serious about 5 years ago. So this is what really pushed me more into biological dentistry, and people need to know because I had a heart history. I've been in 2 comas, malignant hypertension, and a lot of stuff going on. So I just want to say that had not been for me taking care of some things holistically, dental-wise, I probably would not be sitting in this chair, especially with the wonderful Shievon Cammon having a dream that I had a heart issue. And at 5 o'clock in the morning, she called and I said, honey, don't worry about it. I met someone. We're going to take care of it. And lo and behold, we did. And come to find out there was a really big tumor cyst underneath the heart meridian tooth. But I just want to say, Doctor, you are a pioneer. And my journey, and I'm just so happy to have you here because people need to know. I have a lot of people watching this show today, and you have a vast knowledge in integrative medicine and also in biological medicine. We both love Hal Huggins, Dr. Hal Huggins. He was been a guest of mine in the years ago, and you're taking over, and I understand you have this wonderful book that's going to be released. But we're going to kind of jump in because there's so many people watching. Number one, they don't even know what is biological dentistry. What is the difference between going to a conventional dentist and a biological or holistic dentist?
Well, the difference is a complete different paradigm shift. In conventional dentistry, as I was taught in dental school, the purpose of conventional dentistry is to restore the teeth so that they last a long time. That's the purpose of conventional dentistry. If something at any cost, fix the teeth. And the definition of a good dentist is one that does dentistry that lasts a long time.
Yes.
Whereas biological dentistry, the dentist is more interested in how does the dentistry that I put into somebody's mouth affect their whole body? And how does the problems that they have in their mouth today reflect what's going on in their body? So the saying in biological dentistry is, as the body goes, as the mouth goes, so goes the body. If you look inside somebody's mouth and you see all kinds of problems, the problems are not limited to just the mouth.
Yes.
The problems are connected to the rest of the body. The mouth is just simply a barometer that tells you what's going on in the rest of the body. So biological dentistry, we want to know exactly how is this going to affect what I do for the patient? How is it going to affect their body? And the opposite is true also. How is what they have in their body a picture of what's really going on in their mouth and in their body? And it's all connected.
It certainly is.
You know, it sounds ridiculous, but the mouth is connected to the rest of the body. There are many dentists who would say, what? Yes, the mouth is connected to the rest of the body. My very first day in dental school, we all had our brand new jackets on, that had doctor on it. And we're standing up straight and going, yeah, I'm a doctor. This is just wonderful. And they announced to us that they're going to train us to become doctors of the head and neck. And we're all very proud of ourselves. The very next day, they began teaching us how to fix teeth. And that's pretty much where it ended. I remember in dental school having 1 hour of nutrition where they very quickly ran through the vitamins, and that was the end of the class.
Wow.
We were taught to be tooth carpenters, period. And then they're amazed when they graduate from dental school and other physicians refer to us as tooth carpenters. Well, no kidding. That's what we were trained to be.
Exactly. And,
but the opposite, the absolute opposite.
You certainly are. And I've heard of the amazing work that you do, and not just amazing work. Your facility is just absolutely gorgeous. I went on your website and it is absolutely gorgeous. But before even getting into that, I want to, start going through some of the charts that you actually send us. Let's just get into a little bit more pathology. And before that too, I just want to say I have a patient with a rare form of, I don't like the word cancer, so I'll just use abnormal cells. And a lot of times people will tell me, well, my family member has had no dental problems at all. I just want you to explain when a person has had no root canals, no amalgam fillings. So what happens if they've had wisdom teeth removed?
I have never seen a patient, and I've been in this field for many years, I think last count 45 years. I have never, ever, ever seen a patient with a perfect mouth and no health problems. It does not exist. Even if they don't have a single filling in their mouth, usually they've had 4 wisdom teeth taken out.
Yes.
And usually 30, 40 years ago. Well, what happens is those wisdom teeth sockets where the teeth were taken out 30, 40 years ago never fully healed. So they become little cesspools of infection. And that has been in the body for 30 years. It starts to really have an effect on the person 30 or 40 years later, which is why our patient pool are people who are usually 40 to 60 years old. And it's been 30 years since 30 years since they had their wisdom teeth taken out.
Yes. So we're going to jump into some of your slides and let you discuss those, okay?
Okay, so you want to jump right into cavitations?
Yes.
Okay, let's jump right into cavitations. Because the number one question that people ask me all the time is, how do these cavitations form? Why does the bone not heal? You have to know I'm very much a dental heretic because I believe in telling the truth. I believe in telling exactly what I see, no matter what the textbooks tell me. This is what I see.
Yes.
And what I have seen over the years is that almost every dentist on the planet, except the biological dentist, Every dentist on the planet, the layperson, Novocaine. We have all different kinds of names, bupivacaine and Procaine and Prilocaine, and they all have different names. But the average layperson knows it as Novocaine. 99% of all the dentists use Novocaine with, now what's epinephrine? Epinephrine is actually a natural chemical that is produced by the body. It's produced in the adrenal glands, and it's what we call our fight or flight chemical. If a mother sees her child just got stuck under a car, suddenly she has the energy to get up and pick up that car.
Yes, she does.
She would never be able to do that. But the reason she's able to do that is because the body rushes a surge of epinephrine throughout her body. It causes all of her vessels to contract. It causes her muscles to contract. She becomes superwoman for that second, that moment in time. So epinephrine is our fight, what they call our fight or flight chemical. If there's a lion chasing you, the epinephrine is what's going to help you survive that episode and help you to climb up that tree.
Okay.
All right. So why do dentists then put epinephrine, a synthetic form of epinephrine, why do dentists put that synthetic form of epinephrine into Novocaine? For several reasons. Number one, epinephrine causes the blood vessels to contract. So all the blood vessels get smaller. The smallest of the blood vessels, which are the capillaries, they close completely. They are completely sealed. So why is that a good thing? Well, it's a good thing because the patient then stays numb for a good 2 hours sometimes. Yes. And they can continue working without having to stop and give the patient more Novocaine. It's also a good thing because then the patient will stay numb for a long time and not bleed. Remember, vasoconstriction or shrinking of the blood vessels, so the patient doesn't bleed. So this is just wonderful. We got the patient numb for a long time, and we have the patient not bleeding for a long time. Right. That is just wonderful. Mm-hmm. Here's the rest of the story, which none of the dentists even want to pay any attention to whatsoever. When those smallest of capillaries, which carry oxygen to the cells, when they close completely, there is no longer any oxygen going to those bone cells. So I once asked the world's leading oral pathologist, he's actually a specialist in bone pathology. I went up to him after a lecture and I said, Dr. Jerry Boku, tell me, just how long can a bone cell go without oxygen? I expected him to say an hour, 2 hours. No. He scratched his head for a moment and he looked at me and he said, well, Blanche, he said a bone cell can go without oxygen about 34 seconds.
Oh, my goodness. 34
so that means
seconds.
You have tons of bone cells literally choking, not getting any oxygen, and now they're dead bone cells.
Oh my.
The dentist goes ahead and takes out 4 wisdom teeth, usually done all in one visit, usually within 30 minutes, maybe 45 minutes at the most. 1, 2, 3, 4, bada bing, bada boom, as we say in New York. The wisdom teeth are taken out, cotton put in the patient's mouth, and they're sent home to recuperate. Well, now we've got a socket lined with dead bone cells. Bone cells do not reproduce.
That's so true.
They do not make.
You know, what we're going to do, I think you have
some healing, but not on the bottom. And so this cesspool of dead bone on the outside and fluid with bacteria on the inside sits there for a long, long, long time. And it finally gets to the point after this
you know, doctor, you have
time, and the bacteria have grown to toxins. Toxins nothing more than eat. Are we having a problem?
Yes,
Hello?
We're having a little technical difficulty. If we could just take a break just for a moment and actually give Shievon and I would like to just give a shout out for our sponsor, and our sponsor is NuWellness Healthcare. We just want to thank NuWellness Healthcare for being the sponsor for NuWellness TV show, TV and radio here at UBN Studio. we are just so grateful. And as our sponsor, Shievon, do you have anything you'd like to add in regards to our sponsor?
NuWellness, as you explained, is a full functional holistic center where we practice actual true care, all the way down from sports nutrition, keeping those athletes fit and full of energy, to dealing with people with abnormal cell growth and modulating the immune system, coupled in with full body scans, biochemical assessments, genetic analysis. We look at the entire person to assess the direction in which your health is going. Thank you, NuWellness Healthcare.
Thank you for being our sponsor. Now we're going to come back. Now, Doctor, what I'd like to do at this point, because I've seen a lot of children, as you know, and all the mercury they put in their mouth and the metal, and you have a really great picture of, it looked like silver in a child's mouth. We have this on the screen right now.
Yes.
Can you kind of talk about this picture for us?
Actually, I get very sad every time I see this. This is a picture of a small Hispanic girl, probably of Mexican background, who went to a clinic in Texas. Now, there are some, I'm just going to come right out and say it, some very disreputable clinics in South Carolina, North Carolina, Texas, I'm not sure about Louisiana, that are treating a lot of Hispanic families. They separate the parent from the child right away. As soon as the parent comes into the waiting room, the parent is left in the waiting room, the child is taken into the back of the room, and they're usually strapped to a board. They're sedated. Then they proceed to cap all of their teeth. In order to put those silver caps on, what you see as silver caps, they have to drill on every single tooth all the way around and turn them into little stubs. Those are not silver caps, by the way. Those are what we call nickel chrome crowns.
Oh my
goodness.
And
almost anybody in science knows that nickel is very much a carcinogenic.
Yes.
Well, there's one sentence in a pediatric textbook that says, if the dentist believes that the child is not capable of taking care of their own mouth, then the dentist is justified in putting a stainless steel crown on. And very, very often in the beginning, they will go in and do something called a pulpotomy, which is a partial root canal, and that's a crown on top. Well, this little girl came to my attention because a very, very dear friend of mine, who is a urologist in Texas, came to see me, had her dental revision, and her eyes were open to the whole mercury, root canal, nickel crown issue. She called me up one day and she said, Blanche, she said, what are these little silver crowns that I'm seeing on all these children? And I explained to her, those are nickel crowns. I said, and they're very toxic. And she said, well, it's very interesting. I'm having a lot of young people, the age of 3 to 5 years old, who were at one time potty trained and totally holding. When they get these put in, I'm beginning more and more coming in urinary tract infections and even some incontinence.
Incontinence in children of 5 years old?
Well, if a urinary tract infection gets bad enough, it's pretty serious.
Yes, it is. Most definitely.
So she and I decided to do a little project, and she became the tooth fairy. Yeah, she became the tooth fairy, and any child who had a nickel crown, if they brought the crown in to see her after the baby tooth had fallen out, she would collect them and give each child $5 for every tooth with a nickel crown on it. She sent me a bag with 100. I cut off 100 crowns under a very powerful scope because I wanted to make sure that my very, very fine diamond did not actually touch the tooth. And as I cut the crowns off, I would be able to cut a real fine line, pop the crown off, and take a serious look at the tooth underneath. 95% of those teeth did not have any signs of decay whatsoever. And we went on a rampage. We were so angry about this whole situation.
I'm sure you were.
16
Now,
minutes.
Dr. Groovy, the
Yes.
tooth is actually alive. So when you put this metal over a live tooth, how does it impact the tooth in the body?
It dies a slow death because the normal passage of fluid is from the inside of the tooth to the outside. Just as our skin, we are constantly evaporating water. Even if you don't feel sweaty,
Correct.
you're still evaporating. You're still having water flow from the inside of your body to the outside. And if you don't drink anything for 3 days, you'll probably pass out from dehydration. Correct?
Exactly.
Correct.
Yes.
Well, the inside of a tooth is the same thing. Water flows from the inside of the tooth to the outside. And by doing this, it washes the dentinal tubules. Those are those really fine little tubes that actually make up a tooth. It washes them, pushes bacteria to the outside enamel surface, and helps keep the tooth healthy. When you put a stainless steel crown over the tooth, then there's no more fluid flow from the inside to the outside. And so you wind up with a tooth that eventually dies. Now with children, it's you're playing a time game. You're playing a catch up game. Hopefully, and this is the hope of all pedodontists and dentists who do these treatments on children. Hopefully, the tooth will get loose and fall out before it dies completely. What a lot of dentists do is that they go ahead and do a pulpotomy. They kill the tooth. They do a root canal. They drill a hole in the middle of the tooth. They remove the pulp. They put some very, very toxic chemicals like phenol and formaldehyde, formicresol. They put this inside the tooth and then cover it with the stainless steel or nickel crown.
Oh my
And those
goodness.
chemicals that I just mentioned are the very same chemicals that the Egyptians would use to mummify the body.
Yeah.
It's the exact same chemicals.
My.
And so by putting these very strong chemicals inside the tooth, they're mummifying the tooth and trying to keep it in the child's mouth as long as possible. Remember, the paradigm in conventional dentistry is keep the tooth as long as possible.
Well, there's a little technical difficulty. I don't know if you guys can hear Dr. Groovy.
Doesn't there.
You have such a wonderful last name, Dr. Groovy. That is, you must be a very groovy person. And after speaking to you on the phone last night, I know you're a very groovy person. We had a great time on the phone.
Well, it's actually my husband's last name. So
Okay. But it's a fit for you too. It is a fit. So I want to say, this is really wonderful. I was at a symposium about several years ago in Long Beach, and this poor gentleman came in tears, and he said they took his son out of school. He was in elementary school, and said that he could not come back until he had a mercury filling. Now, not only just the vaccinations, but a mercury filling. I was so shocked. I said, "Are you sure?" They said a mercury. They said they won't let him back in school. And this is several years ago. So there's so much happening. Parents have to really ask questions.
Right.
They can, call myself at NuWellness Healthcare at 310-419-4300. We can follow that up with you, Dr. Groovy.
Sure, I'd be happy to.
And, definitely because you're not here in sunny California. You're now...
Not yet.
Yes.
Not yet.
But I know there's going to be some people flying to see you, because it doesn't matter where you are when you're looking at your health and your life, because your mouth is, Dr. Huggins' book was entitled what? It is all in your head.
All in your head.
It's all in your head.
Part of your head.
Yes.
Only this part. Yeah, right.
Yes.
It's all in your head, right? But only that part. As a matter of fact, we've just finished up the 7th edition of that book.
Can't wait.
Wow.
Yeah, what I did was I took the privilege of rewriting a lot of words coming out this spring also. The 7th edition of It's All in Your Head. Yeah, sold millions of copies of that book.
Oh, I know, because I have several copies, and while patients are in the waiting room, I have them to read over it, and they're like, really? Because so many people come to me, and they just don't believe that this is happening from their teeth because of the meridian.
Correct.
One lady had severe pain in her breast, and she had insomnia, and she had this cough.
Oh, no.
But I did in my office what is called a CRT, which is a thermal imaging. It's FDA approved for the breast, but it happened to have 119 acupuncture points. So we can kind of look at the teeth. And I said, I'm not a dentist, but look, you have some things hitting your breasts. You have things hitting your lungs. I'm just going to refer you to, a biological dentist until we can get them to you, Dr. Grube.
Right.
And once he did the extraction there on that meridian of the tooth going to her breast, sitting in the dental chair, the pain was immediately gone. And now she's no more insomnia. She's doing really well. I would like for her to definitely follow up with you too. But it's just amazing, people, when they understand the tooth organ relationship and how you to really heal, you have to start with the mouth first.
And, in saying that, Dr. Grube, in your practice, what is the primary issue that you're seeing?
Most of my patients are, like I said, the 40 to 60-year-old category, and their biggest concern is chronic fatigue. Their second biggest concern is cancer. And my patients come from all over the United States, all over the world. Those are their two biggest concerns. They just don't feel as good as they used to. And of course, the cancer,
I'm sorry,
tried everything. And while we're talking about breast cancer, I have to include the fact that in all of the years that I've been practicing, especially since I was trained by Dr. Hal Huggins, I have never, and literally probably 1,000 patients with breast cancer have come through my office. I have never seen a patient with breast cancer that did not have a dead tooth or a cavitation. Not a one.
Wow.
Not one.
And the same for prostate cancer as well?
Prostate cancer. If a man tells me he's got prostate cancer, I want to know which front tooth got banged when he was a little kid. Which front tooth has a root canal? Which front tooth was knocked out playing hockey?
Wow. Wow. The body is so well connected.
Right. The body is connected, and energetically is really the only way that we can really ask the questions, what's really going on? It's only energetics that's going to give us that answer. You can't tell what's going on by looking at a blood chemistry. Even though every single patient in my office has a blood chemistry, has a hair analysis, it doesn't always give me all the information. We have to go to energetics to find out what's really going on.
And when you say energetics, what exactly are you speaking of?
Well, in energetics, everything is included, muscle testing, CRT. Some people use called the Zios machine. Some people are using the CyberScan. Some people use usually just a simple EAV machine, that's electroacupuncture by Vol. Anything that addresses the energy fields of the body. And it would be good if it specifically, like you said, if it specifically goes to an acupuncture meridian, it's more straight arrow shoot and tells you, here's the problem.
Exactly.
It doesn't tell you what the problem is all the time. Usually then the next person has to come in. Seldom does somebody get completely well with the care of just one doctor and one modality. That doesn't happen.
It's true.
It's usually, it's a team approach, and it's usually several modalities before we can get everything back together again and head that patient on the right path.
The one thing that I like in this part of Dr. Hal Huggins' protocol, and I've also worked with Dr. Thomas Levy, is having your vitamin C IV dripping while you're having your dental work done. And tell us why that is so important. I know it is, but once you share a little information.
I like to explain things in a simple way so that the average everyday person can understand it.
Perfect.
Every time you have a toxic chemical, a toxic bacteria, virus, yeast, fungi, doesn't matter what it is, it robs the body of an electron. In order for the body to detoxify, it must spend money, which I call the electrons. Electrons are the money system of the body. So every time the body has to take a particle, a little molecule of mercury out of the body, it costs money. It costs an electron. So eventually you get to the point when you're really sick, you're very tired. Why? You've run out of electrons.
Yes.
No electrons. The person who runs out of electrons completely is the one who dies first.
Coupled with malnutrition.
Right.
various nutrients. Well, if you're
Right.
deficient, you're not going to move those toxins out of the body. It's going to accumulate.
So what do we get when we eat food? Electrons. When we
Yes.
eat food, when we eat good food that's alive, we get
Correct.
electrons. When you
Exactly.
take vitamin C IV, it provides the body with more electrons. So we have to use the expression vitamin C is an electron donor in the body.
Wonderful.
So
Wonderful.
yeah, so we have something called glutathione. It's a chemical the body produces, and that is our number one detoxifier, specifically
Correct.
of heavy metals.
Yes.
Every time glutathione goes through the toll booth, which is the kidneys, he has to pay the toll. And once glutathione pays the toll, he has lost his electron. That glutathione molecule is good for nothing. Well, here comes vitamin C and says, hey, glutathione, would you like another electron? It's free. Oh, sure, thank you.
Yes.
Vitamin C gives the glutathione another electron. Now that glutathione is ready to go and get another molecule of mercury, another bacteria, another virus. So when you're doing a dental revision, it's very important to have IV vitamin C flowing through the bloodstream.
I think
That's our
so.
fail-safe mechanism.
Yes. Yes. I think it's wonderful. We have a few more charts and want to try to put them up and you can explain a
Okay.
little bit more. There's a chart now that's showing, and can you tell us a little bit more about this particular case?
If I could see it.
Okay.
Can you
Okay.
describe it to me a little bit?
Okay. We had some arrangements prior to, but anyway, it looks like there's a post where people are doing implants.
Is it white? A white post?
It's actually dark.
It's a dark post. So that's a titanium implant.
Okay.
Okay, and so, of course, people ask me all the time, doctor, do you do implants? Yes, I do. I take them out. I do
Plain
root
and
canals
simple.
also. I take them out.
Yes.
Okay.
Dr. Grube, can you
Titan-
talk about the biocompatibility and how that impacts a person's health as it relates to dentistry?
yeah,
With implants?
if that your body, like an
Correct.
implant, that your body is reactive to, you are going to eventually suffer some sort of symptom. So it's very important that the patients, if they're going to have a lot of dentistry done, that they have a biocompatibility test done. Now, the lab that Dr. Huggins developed is called Biocomp Laboratories. And so patients can send their blood to the laboratory, get tested, and literally get a whole list of dental materials that they're either highly reactive to and should never put in their mouth, or something that they're least reactive to. You notice I didn't say not reactive, because there really isn't anything that the body is going to accept. If you're not you, your body knows you're not, this something is not you. And if it's not you, your body is going to spend some time trying to get rid of it continuously, a lot of time. So it's very important to have a material that, okay, it's not me, but at least it's least reactive. It doesn't upset my immune system so
Yes.
much so that I'm going to be spending millions of white blood cells every day trying to get rid of it.
Yes.
Very good idea.
What is your take on? I know I hear different people talk about antibiotics and why they should or should not take them as it relates to dentistry.
Now, there's a time and a place for antibiotics,
Mm-hmm.
but antibiotics have been overused to the
Yep.
point now where we have microorganisms that have morphed, have changed, and now there are no antibiotics that will affect them.
Yes.
So, if you look at the word, look at the simple word. Again, let's keep it simple. Anti means against, biotics means life. So antibiotics are drugs that are against life.
Yeah.
So when somebody takes an antibiotic orally, they're not only getting rid of some of the bad microorganisms, you never get rid of all of them. You're not only getting rid of some of the bad microorganisms, but you're getting rid of a ton, if not all, of your good microorganisms.
Yes.
Hal Huggins used to always say, after taking an antibiotic, you really should go on breast milk because that's all you can digest. Of course.
Well, that's maybe why I use so much colostrum today.
Right.
Yes.
If one antibiotic wipes out all the good bugs in your gut, And now you've got to start to rebuild, and rebuilding sometimes is not so easy.
No, it isn't. No, it isn't.
Now, I have a question. I realize that there are a lot of waters, a lot of toothpaste, and a lot of conventional dentistries using fluoride. To, of course,
that too. We're covering
yes. Please tell us from the biological, from the holistic aspect, from the true pioneer, what is the truth behind fluoride?
You mean rat poison, stannous fluoride?
Most definitely. Definitely rat poison. Yes.
That's exactly what it is.
And a carcinogenic.
It's a carcinogenic.
Yes.
Absolutely.
Mm-hmm.
It causes arthritis. It causes glaucoma. It causes brain problems. There was just recently, just this 2 days ago, came out a new study showing that fluoride affects brain function. Okay? And you know what is very interesting? That, the American Dental Association says, well, a small amount of fluoride is very beneficial. Well, that's very interesting, because if anybody's ever studied homeopathy, you know that a very small amount of a material can have disastrous effects.
Yes.
Disastrous effects. But you know what? The amount of fluoride in a tube of toothpaste is not at all small.
No, it isn't.
Yes. That's why it says on the toothpaste, you know what? If a child swallows this, rush them to the hospital.
And poison control. Poison control is all on there. Yes.
So what do you recommend for cleaning the teeth and maintaining dental health?
Well, my two favorites are salt and baking soda.
Very good.
Okay.
Mm-hmm.
I mean, really, that's probably the best thing on the market. If somebody has gum disease and their gums are bleeding, well, now they have to get a little bit more aggressive and put a little bit of sodium ascorbate, which is the salt version of vitamin C, not ascorbic acid, sodium ascorbate. Okay. They need to put a little bit of sodium ascorbate in a water irrigator and irrigate their gums with that. Here again, I'm the dental heretic, and I know I make a lot of enemies, but I've never really understood why we go to the dentist every 6 months and ask them to clean our teeth. Do we go to the physician and ask the physician to give us a bath? Do we? Do we say, hey, doc, do my armpits right over here, and don't forget to get the back.
Right?
Because,
so true.
Yeah, I haven't been doing a great job, so I really need you to clean things up for me. No, we don't do that. So why do we go to the dentist every 6 months and have the hygienist clean our teeth? It's because we're not trained. We don't know how to keep our mouth clean. We don't know that if you've got tartar building up on your teeth, first of all, your metabolism is really out of whack. Your nutrition is terrible. You need a lot more help than just a cleaning.
Yes, you do. Definitely.
You need a lot of help. So people go to the dentist, they get their cleaning, they walk out with teeth shiny and new looking, and they start all over again. Same bad habits, same bad eating habits, not cleaning their mouth properly. You don't get a cavity due to lack of fluoride in your diet. You get a cavity due to too many refined carbohydrates, too much sugar in the diet.
Exactly.
For oral care, right?
And people need to realize if you have bad teeth, there's definitely something going on with your bones. Definitely something going on with the bones, just like you had stated earlier. Yes.
Yes. Now that one super...
The only part of the only part that's rotting, that's for sure.
I have to agree. Now, you highlighted briefly on root canals. There are a ton of people not only walking around with mercury, but with root canals. Please highlight, what is your approach?
My approach is to remove anything that's dead in the body.
Okay. Remove it completely.
Yes, not only be removed, but then the socket has to be thoroughly cleaned out. So your average everyday dentist is not going to know how to remove a root canal tooth properly. You must remove the tooth, as Dr. Hal Huggins used to teach. You must make sure all of the ligament that held the tooth to the bone. And when it comes to root canal teeth, you have another 0.5 millimeter to 1 millimeter of infected bone that also must be cleaned out thoroughly. And all of play a role. Right, and it has to be done without epinephrine. If you use epinephrine, you're kind of going to be back where you started from in 10 to 20 years with a huge cavitation.
Yeah.
Now, if you see someone come in your practice that requires, don't actually have a root canal, but the dentist say, hey, you need a root canal, what would be your approach to that individual?
You don't need a root canal.
No, you
Nobody
don't.
needs.
No.
You need somebody to hit you in the head with a baseball bat?
A need. That's not a need. Exactly.
That's a funny word, need. Nobody needs a root canal.
No, they don't.
But it's unfortunate, you have all these individuals that lack the understanding of what true biological dentistry is and how to really care for their teeth. So you have this professional that's a dentist that they rely on that tell them this is what you need. And they're giving them to as young as teenagers, and it's troubling. I think what you're doing is so powerful,
Yes.
getting that word out there, watching your YouTube videos. You're very active with educating individuals on the care, the oral care, what should be done on a holistic level, what biocompatibility is, how to really manage and take care of your oral care. And I think it's powerful. We need to break past the myths, like with the fluoride, the root canals, the mercury. I never believed that there was a one size fit all protocol for everyone's teeth.
That's correct.
Right. And the sad thing that I've seen is people who have been pregnant and go to the dentist, being pregnant and have mercury fillings and have all this work done during pregnancy and not knowing that this is transmitted into the baby.
And that child is born already mercury toxic.
Very mercury toxic, yes.
So then they give the child one immunization shot, and the baby's body experiences something called a secondary autoimmune response.
Yes.
And then they wonder why the child is autistic.
Yes.
We have an
seen so
epidemic
much of that
now in this country of autistic children.
Yes. That percentage rate has gone higher and higher. And unfortunately,
I want to know 40 years from now, who? Right? If 1 in 3 is autistic, then that means you have 2 taxpayers to take care of 1 child.
My.
That's a good way of looking at it.
It certainly is. It certainly
people
is.
have to realize it starts in vitro.
Correct.
Parents have to be educated. Mothers have to be educated. And, we do have a lot of conventional dentists out there. And, I think it's probably a ratio of 10 to 1 to biological dentistry. And it makes it hard because you have this 10%. I have children, and a part of, I'm going to be honest, a part of their kindergarten assessment is having a dental visit. And my daughter, they wanted to do x-rays. I was like, you can do a visual exam.
That's right.
Exactly.
It's unnecessary to do x-rays.
Exactly.
She was like, a visual exam. I was like, yeah, she, her teeth are nicely spaced. They're not crowded. And you can do a visual exam.
Correct.
And I requested it, and she almost wanted to deny it, almost telling me that she wasn't going to complete this paperwork, right?
Exactly.
Yeah, you're lucky she didn't kick you out.
She almost did.
Right? So I think as parents, we need to know. We need to take the time. And for those that are listening to this radio show, if you have nieces, nephews, cousins, friends of young children, yourself, you need to share this information.
Definitely.
I know it sounds so minute, and to people it sounds so minor, where they're just teeth, they're just teeth. Well, is your body just your body? Is your health just your health?
Yeah, if it's just a finger, cut it off.
Just a finger cut. Yeah, you can't do that. I like the story. If you can, we have a few more minutes to talk about, I guess we can't really go into the whole rabbit with Dr. Huggins when he did the research with the rabbit itself and what they did. We have a couple of minutes if we can do this real quick.
What Dr. Huggins decided to do was to repeat the tests that were done, the original research that was done by Dr. Weston Price.
Yes.
Early in the 1920s, 1930s. Dr. Weston Price had the experience of having a young patient, 16-year-old boy, die of a heart attack. That 16-year-old boy had just had a root canal. Dr. Price removed the root canal before the boy was buried. He then took that root canal and put it in the ear of a rabbit. Within 24 hours, the rabbit died of a heart attack.
Yes.
He took the same tooth out and put it in the ear of another rabbit. That rabbit died of a heart attack within 24 hours. He then took that tooth out and put it in 200 consecutive rabbits. This is the sign. This is a sign of true scientific research.
Definitely,
Yes.
definitely.
200 poor bunny rabbits, because I love bunny rabbits. It's a sad
Too.
story.
Yeah, they're so cute.
200 rabbits died of a heart attack.
My.
It was such a turning event in Dr. Weston Price's life that he then began to tell the American Dental Association. Oh, and by the way, he was the lead researcher for the American Dental Association. He had a team.
I remember. Yes.
Yes, this is no quack, no nut on the fringe.
Yes.
He had people like Charles Mayo from the Mayo Clinic who was working on his team. He had some the top brilliant scientists in the United States working on his team. He told the American Dental Association that they had to stop telling dentists to stop doing root canals. He dedicated the rest of his life to proving this point. The young man who died of a heart attack at the age of 16 was his son.
Oh my goodness. I remember the story from Dr. Hal Huggins when he was a guest on my show years ago. And it just is so painful. And I shared this with other people. So I'm so glad we were able to get this in before the closing of the show. When you are in town, we have to have you in studio. Because you're just wonderful. Absolutely. And you're going to have to come because we're going to make sure that everyone see this show. Please pass this information on to your family. We have to do everything we can to save lives. And I am just so grateful for Shievon Cammon, who is a clinical nutritionist, who's here with us. I'm just so happy that we were able to have this type of show today. And Doctor, you have been phenomenal. I do thank you immensely for being here today. But I would like to have you in studio because there's so much more we can show and do. So thank you so very much. And thank you so much.
Please pray for me. Continually pray for me, because if I don't have a legion of angels around me, those angels protect me. All right.
Yes. Well, you have the two of us, and anything that we can do, we will be there for you. And I know some other people who are working with you. You have a team of a legion of angels. Even your ancestors are all there with you, supporting you through this, because you have work to do, and we have to get out this information. So when you are in town, we need to have you in studio. I just thank you so much.
Happy to come.
I'm thankful for you for having us here. And it's just absolutely wonderful. And my wonderful person here that's working the controls here, Jarvis, you are absolutely wonderful. And thank you, Tony. Thank you so much. I thank everyone. And as we close this show, just remember, if you do not take the time yourself to teach your family and your loved ones, each one teach one. Share this show with everyone. Please share this show with your friends, your family, your church members, your synagogue, whatever. Share this show, because this is a show that can save your life and your family. We start where? In utero. So it's not a show just for the seniors. This is a show for everyone. So again, I want to thank everyone for listening. And as I close the show, please repeat after me my wonderful saying that I say here all the time. I am so grateful.
So grateful
that I am a magnet for miracles.
A magnet for miracles.
Everyone have a wonderful, blessed day. Take that into your heart and feel it.
Beautiful.
Yes.
Join us every Wednesday live at 11 a.m. for NuWellness TV with Dr. Lee. Remember, healthy mind, healthy body.